Thank you very much. Welcome, David.
Thank you so much, Dr. Muya. I really appreciate the very warm welcome and greetings from Nairobi, Kenya. I'm happy to join you during your webinar, and this is a great opportunity for me to share about myself and about the work of CBM. My name is David Munyendo. I work for CBM, Christian Blind Mission, as the country director for Kenya, based in Nairobi. I've been in CBM for the past 12 years. I'm a social worker by profession, but in terms of practice, I'm very passionate about system strengthening. I have a span of 23 years in the development sector, implementing or supporting implementation of diverse programs ranging from behavior change communication, health, education, emergency, livelihoods, and so many others. So it's really my pleasure that I have this opportunity to share with you. And upon invitation, I'll focus on the community-based inclusive development. Hope you'll be able to see my slides. Let me just share. So I'll be taking you through a few slides, and feel free to interrogate thereafter. Also make your contribution. I'm happy to say that I have my colleagues here. So in the event of the plenary session, I'll also invite them to engage as much as they can. Based on the webinar focus, I'll focus so much around unpacking community-based inclusive development, understanding the concept, some of the challenges and opportunities. And I'll have a special bias because CBM is focusing on disability inclusive development. So you may find that most of my examples or citations will be towards disability inclusion. This is just a summary of what I'll take you through, getting to understand a bit about CBM, diving into the concept of CBID, also underscoring some challenges and opportunities, and then thereafter an open session for question and answer. We may already have an idea about who CBM is, but for the sake of harmonization, I'll say that CBM in full stands for Christopher Blind Mission or Christian Blind Mission. We are a development organization founded by Pastor Ernest Christoffel in 1908, meaning that we are over 100 years old on the globe. We work globally in the continents of Africa East and South, Africa West and Central, and in Asia and Latin America. So the country I work for sits in the Africa East and South Regional Office based in Nairobi. Our main aim is to improve the quality of life of persons with disabilities across the globe, because we understand that poverty and disability, actually they go hand in hand. If you have a disability, you are likely to be poor because of so many other things that we shall be discussing. And again, when you are poor, you are likely to acquire disability or an impairment that will lead to disability, because again of so many other parameters that I'll be discussing later on. Our model of partnership is that we work through implementing partners, whom we call can be local, can be international, can be regional, but basically we have a shared vision whereby we work on a common cause to improve quality of life for persons with disabilities. Our model of implementation is to break the cycle between poverty and disability. And we do this through a twin track approach. Some interventions focus on the person to ensure the person has adequate capacity, has income, has access to assistive devices or technologies, has access to opportunities like even education, and so many others, while others focus on the environment by addressing the barriers that bring about limitations or restrictions for the person's abilities to enjoy their human rights and achieve their full potential. We work with both government and non-government entities, with local communities and organizations of persons with disabilities in all these efforts. Our programs focus so much in terms of reducing the prevalence of diseases which could lead to impairments, and also addressing conditions that will lead to disability. I'll be discussing this later, while at the same time promoting equal opportunities towards economic empowerment, livelihood security, and full inclusion and participation in all aspects of the society. Having said this, coming back to Kenya, we have a presence in 22 through 22 projects, focusing in 18 regions. Locally here, we call them counties. And our programs focus on empowering persons with disabilities, focus on strengthening government and community systems, addressing barriers that lead also to enhanced access to opportunities, services, information in the areas of health. And I'm sure Dr. Daniel Muya also alluded that we are so much at times known for eye health, but we focus on all domains of disability. We have partners supporting implementation of rehabilitative and provision of assistive technologies. We have partners in the areas of inclusive education, both the early childhood development, the primary, secondary, tertiary, and even technical. And also we have partners who work around provision of interventions in the livelihoods components, as well as emergency response. And emergency response here, I mean all the cycles of response from onset to recovery to resilience building. Allow me to go to the concept of CBID, because that's where most of the discussion will arise from. And this version of definition of CBID, I'll say it's more moderated to encompass everyone. But usually in our normal language, we shall focus more on personal disabilities. So basically, look at CBID. For us, it's a way of working within community that ensures inclusive development process, that ensures no one is left behind, be it in terms of their voices, be it in terms of tapping on their skills, be it in terms of appreciating the locally available resources, be it in terms of ensuring that their lived experience equally adds value in the day-to-day operations of the community way of life. So we look at it from a point of who are these persons that are likely to be marginalized? And the list is endless. I think if you are to list them, you will not miss women, you will not miss the girls, boys, youth, persons with disabilities, the migrant population, those in hard to reach areas. So the list is quite endless. But the most important for us to ensure that these categories of people are not left behind in terms of economic inclusion, political participation, and even social empowerment processes. So when you look at this CBID model, then you'll be asking yourself, how is it different from CBR? I know for most of us, we are alive to the onset of SDGs. When we are now transitioning from the Millennium Development Goals, there was a lot of discussion around leaving no one behind. So in terms of just drawing the comparison between CBID and CBR, I'll say that CBR and CBID at times are used interchangeably, but they are not the same thing, because CBR has been implemented in many parts of Africa for over 4 decades, while CBID has been popularized for disability inclusion since the declaration of the Sustainable Development Goals. I think that was early 2016. And CBID enhances and strengthens earlier work described as CBR and encourages more inclusive, more responsive, and more accountable communities. While CBR was initially as a strategy aimed at strengthening access to rehabilitation services in a limited resource context. Therefore, CBID is now a multi-sectoral approach aimed at ameliorating equal opportunities and social inclusion of people with disabilities. So the they synergize each other in terms of just how we apply them in our programs. Now, when you look at the principles, what I can just call the framing based on the United Nations Convention on the Rights of Persons with Disabilities, you'll find there are several principles that guide the implementation or the design and implementation of programs that focus on CBID. Quite a number of the thinking here is actually from a human rights perspective, and just trying to ensure that in all the things that you do plan, you don't leave anyone behind, and you ensure that the voices of the persons being targeted really count in the whole process, from the design, implementation, monitoring, and all that. So CBID sits at the center of three, I can say, wheels. One of them is human rights. Another is focusing on the people, being people-centered. Another being driven by the community. So if you put the rights here, you put the people and the community into what I can call an ecosystem, then you can deliver what I can also refer as a meaningful CBID programming. And basically, you have to look at the issues of dignity, respect for everyone, equal human rights application, and also ensuring that persons with disabilities and those who are marginalized are respected from all dimensions. Basically, we're talking about the issues of appreciating the added value of getting their voices into the process. Either it can be lived experience, it could be in terms of privacy, also observing that you also hold a lot of respect for individuals whom you are targeting, and ensuring that you don't actually push something for them, but you ensure that you're actually pushing any agenda with them. Issues of non-discrimination, of course, it goes hand in hand, also looking at the issues of social stigma, issues of the legislative processes, issues of the development paradigm in terms of ensuring that you don't isolate a given sector of the population because of their condition or because of their impairment or because of a feeling of certain people being lesser than the others, but treating everyone with a lot of equity in mind, and a lot of also ensuring that you create a lot of striking of a balance in all aspects of development, and ensuring that the issues of self-representation also is key, because if you don't create room for participation, that means somebody is sitting in for the other, which is really wrong, because as much as you can empathize or you can sympathize, it's really the shoe wearer who knows exactly where it pinches. So getting the people themselves take charge of their own destiny, describing how they want to see the change happening in their own life, in their own communities, in their own aspirations is very important, so that at least you can ensure that you don't assume this will work. Because if you look at even disability, it's not homogeneous. So one that works, say, for a person with visual impairment will not work for a person with hearing impairment or a person with psychosocial disability. So taking into consideration these all dynamics to ensure that people have self-representation, they can voice exactly what they want, and they can drive their own agenda. Then just appreciating that there's strength in diversity, because everyone brings something on the table, be it in terms of knowledge, be it in terms of experience, be it in terms of the skills, be it in terms of even the time they contribute to make it happen, and be it in terms even of just the opinions and the ideas they give during such discussion conversation is very important, because diversity at times can be used to weaken the fabrics of our society. But if you look at it in terms of mapping out and understanding your context, they'll find that the women bring in an added value, persons with disabilities bring in something different. You also bring in intersectionality within the same community. And I think within that kind of lenses, you are able to get the best out of individual contribution. Then also looking at it in terms of access to equal opportunities and addressing barriers, be it in terms of access to education, be it in terms of access to healthcare, be it in terms of access to employment, be it in terms of access to information, in terms of communication, and all that. It's very important because different channels can be used to maximize different potentials in different aspects. So, for example, if you are to say you want to disseminate information, people will consume in different ways. Some will want actually the information to be in Braille. Some will want the information to be sign language interpretation. Some will want information just to be written, but in more accessible formats. Some may want you to use the talking softwares like JAWS when you're using now the voicing in terms of computer. So different applications will actually produce the maximum impact, but you just have to appreciate that you have to create a level playing field for everyone to enjoy their human rights and achieve their full potential. So in terms of accessibility, I think I've also alluded to that. So I'll not again talk on that. But in terms of issues of gender, again, we know that especially in different contexts, different practices create different challenges on either gender. So it really becomes a point of concern that if you really want to drive an inclusive process, one that appreciates equity across the gender, it's something that, again, you have to make sure that deliberately you create opportunities and room for everyone on equal basis so that you don't, again, reinforce the existing stereotypes on either gender. Then equally for children, it's very important that you have to respect their rights. They have a right to access to education. No child is lesser. To ensure that they also have either access to assistive devices. They can also access the learning environment is more enabling within their learning environment. And equally, just ensuring that every child receives a personalized education plan to achieve their best in the process. And issues of influencing policy and say even the laws around disability, around inclusion, is very important because this one can only come out very well if it's coming out from the people who are being put at the center to benefit from this policy change or policy reforms. So always advocating for self-advocacy is very key. But you can support in terms of building capacities for all these target groups to ensure that they actually have capacity to advocate for their own rights and achieve their own potential. Something that always, again, you have to begin with in mind is about sustainability, because many times they are good projects, good interventions, but they're just one-off, they're short-term. They aren't really starting with the end in mind in terms of what do you really want to change to achieve that change sustainably in terms of either systems, in terms of either quality of life, or even in terms of transforming communities and societies. So again, from a point of continuity, it's very important that you begin from what I can say, you can begin from where you are, and you can also use what you have and always do what you can. But remember that in terms of all these interventions, you have to ensure that we have strong linkages between the community and the government, what we normally say between the right holders and the duty bearers. And then in between, you can work on the processes, structures, policies, and all that can make sure it's more functional. So if you look at generally in terms of the CBAD, you look at it from a point of transformation, because CBI was good, and I can't say that it didn't deliver transformation, but it was more localized and more service-driven, let me say so. But if you look at CBAD, it's more of systems-driven. It's more of bringing everyone on board. It's more of thinking how best to close the gaps that create barriers between various levels and various sectors. So if you can start acknowledging that CBAD starts with the localization agenda in mind, I think that's the best thing, because globally now it's a talk about localization, how best to empower communities, how best to empower local actors, and how best to empower individuals to drive their own agenda. And CBAD is very good in this. So that's why I'm saying it's very transformative in terms of a localization agenda, because it starts with the context, the local, that context that you're also trying to address by mapping out who is where, doing what kind of resources exist, what other stakeholders are there, what are the main issues, what are the opportunities that exist. And by doing that, you're able to identify who can be your allies in terms of advocating and advancing the agenda. And you create now networks which brings together people. This could be through committees, it can be through technical working groups. It can be through various structures that you set up in terms of coordinating all these synergies. And also it creates a lot of opportunities, people to bring their ideas, to bring their resources. So a lot of sharing, a lot of learning, and a lot of holding each other to account in terms of what you are planning to do for the people. So you become actually more accountable because you are starting with everyone in mind. You are working together and you are debriefing and sharing throughout. Then also the issue of data is very important because without disaggregated data, then some faces are lost in between. So with CBID, in terms of data disaggregation, it's very key to ensure that everyone is visible through the numbers, through the statistics, through the ratios, the proportions. It ensures that we're able to strike a balance between different population based on the decision making that's well guided and well informed because of data availability. Then through the process of just coming together, networking and growing together, you'll find there's a lot of capacity building in the process. So one could focus on the individual knowledge, awareness level, individual skills, individual capacities, even to apply different technologies and all that. It could focus around capacities in networking, referrals, strengthening connections. It could also grow in terms of even resourcing, whereby you are able to tap into various resources, either locally or even externally. And by doing that, you start gaining what I can call a movement on CBID that can actually transform the entire society. Because now, with one voice, you can approach your legislative process to say this is what we want as a community, or this is what as these people from this geography, to ensure that it can contribute meaningfully in our lives. Then as you do that, you also create a lot of stakeholder collaboration. Some could come from the public sector, some could come from the community itself, some could come from the private sector, and tap into a lot of opportunities that exist through that kind of mechanism. Because unless, again, you do that kind of collaboration, you may find that you focus on what I call one sector kind of response, which becomes a challenge. But as you expand your scope of collaboration, you find more solutions for CBID actually within other sectors, like health, education, like even labor markets, agriculture, coming together collaboratively to deliver on a shared vision. Then, of course, shared a lot of awareness raising and advocacy will remain a cross-cutting element of the transformation that we are looking at. If you look at the bare minimums of CBID, I think I've also discussed this, that in CBID, you must strive to be accountable at all levels. Accountable to the individuals, accountable to the community, accountable to the policymakers, accountable to the funders or even stakeholders. And literally, it creates a transparency process of accountability. Also, in terms of sustainability, again, from what I've discussed in terms of transformative process, again, it's very important that you ensure that all these standards are embedded, starting from the end and thinking backwards and saying, okay, this is what I want to achieve, but how do I get there? And I'm sure by doing that, you are able to get a lot of options or alternatives to get towards the desirable outcomes. Then partnerships, again, are inevitable in CBID because in CBID, it brings together so many components. It could be in the areas of agriculture, education. It could be in the areas of livelihoods or socioeconomic empowerment. Education also is there, emergency response or disaster risk reduction. So when you bring all these players together, some focusing, say, on rehabilitative services, others could be focusing on ear and hearing care, into a collaborative framework, it means that no one person can actually do it all. So you have actually to create synergies among different players, and you're able to achieve much more. Equally, by doing that, you focus so much on technical quality, because in CBID, the outcome is very key, because you want the best result out of this process, either by achieving a very inclusive society where everyone feels valued, respected, and they're able to enjoy their human rights and achieve their full potential. Or if it's, say, on a livelihood, you also want a household that are also empowered in terms of income. They're able to generate their income and able to afford access to other services or opportunities, or even access to other community support services that could be there in terms of social protection, etc., etc. Then also, when you are talking about CBID, there's an element of accessibility and universal design, that you leave no one behind, to ensure that you don't just focus on one component of the people, but also you're looking at the entire sector and saying, okay, if I have to ensure that people have access to this and that and that, what do I really need to put in place? Because from experience, when you talk about even making a health facility accessible for all, I always find that even persons without disabilities actually enjoy most when there's a ramp, or enjoy most when there's a lift, or enjoy most when there's something that actually makes movement and circulation easy. And then issues of participation, again, I've talked about it. If there's no participation, then that's not CBID, because CBID is about voices, it's about choices, it's about bringing together everyone really to make their best, either in kind or in cash, or even in terms of just being part of it, to ensure that the design and the implementation of everything is actually taking care of their individualized needs. And then fairness is the game, but at least you ensure that nobody, again, can be treated unfairly in the whole process. Then, as usual, you can miss some challenges. I just captured here a few, which I'll try to summarize, because of I'm just looking at my time, so that I don't overrun the time. The system thinking and linking policy and working process and the community process are quite a new way of thinking and a new way of doing business. So not everyone is actually embracing this kind of process. So most of the teams who are used to CBR are still used to focusing on services and individualized silo interventions. So it's still a journey, and I'll say that transitioning from focusing on silo processes into an ecosystem of, say, like a system, right from identification to assessment, say to diagnosis, and then also to, say, intervention, then continuous monitoring and follow-up and support until you achieve the desired result, is a process. And I think this one becomes a challenge, because it's always good to fix things which give really quick numbers in short time, but a system will take some time to build and strengthen, and it may give actually the impact later, much later in the course of the project. But at times the challenge is, how do we fix the connection between committee processes and policy making process, which is at times very high level and very technical, and always disconnected from what the community wants to see. Then that's around the issues of technical expertise. It's not easy to get all expertise in all these areas, because CBID is almost everything being brought together. And at times you find one expertise in this education area, another in livelihoods, but the rest go missing. So again, it's really a challenge that you get everyone on board, but it's a process that, again, you can look forward towards building and ensuring that it grows over time. Then also, there's a lot of confrontation from the external shocks, some coming from the climate change, some coming from economic depression, for example, inflation and all that. Some coming from just the culture of the people themselves getting resisting and all that. Some coming from political, could be change in policy, change in regimes, and even some from pandemics like what we saw in COVID that actually breaks down the social fabric and the support mechanism. There are challenges around the issues of multi-sectoral collaboration, which requires a lot of alignment with various sectors. At times they could be chasing their own priorities, and bring them together into a shared vision and framework also is time consuming and energy consuming. And then the other ones around the issues of instabilities, either in governments or economic environments, in terms of either some governments are quite unstable in terms of civil strife, insecurities, and even now what's happening currently between Israel and Gaza. It becomes a challenge generally because it may be seen far, just like what Dr. Muya said, but it's very close to us because of the impact. Then in some governments, there's a shrinking space of the voice from the civil society. At times they are normally branded as anti-government. So you can't really get a lot of favorable support and even financing from the government because you are seeing like you are pushing so hard for the government to support you. Then that's around the issues of donor and the funding world. There's a shrinking availability of resources globally. And therefore, the issue is how do we push governments to start allocating support towards initiatives around CBID? Because normally, generally, you'll find that whatever is available, for example, through the community social responsibility, the CSR components, it normally goes for the quick wins of intervention that are short term, and that's all, and one off. So they don't stay there long to see a lot of changes. And this could be just dynamics that also can be a pointer for us to see how best we can start adapting. However, all is not lost. There's a lot of growing worldwide acceptance of the Convention on the Rights of Responsibilities, and even different governments have also domesticated that. And also appreciation of the SDGs, and a lot of governments are also developing programs that also advancing social protection and access to community support services. And so many governments are now towards the push on universal health coverage and so many other things. So you'll find that we can tap on all this to ensure that it takes the community-based inclusive development way. For example, in Kenya, we have now the push around primary healthcare networks, which is basically a model that we can leverage on and actually advance the CBID model. I'm also happy that a lot of regional organizations are actually increasingly focusing on modeling around community-based inclusive development. And there's a lot of desire to see evidence through a lot of research to inform decision-making. And right now we are leading a community that's very fully aware of their rights, and they want a better return on their money. And I think this is the best thing because when the communities are fully aware of their rights, they'll hold the duty bearers to task to be more accountable, and even to donors, and even to implementing organizations to be more accountable on every aspect of programming. Also, there's a lot of focus on localization, system strengthening, and focusing on individual person. Holistic programming is actually now taking shape. Unlike before, which was more or less like focusing on an impairment or say a disease burden, but now the focus is more on holistically on a person. Like for Kenya now, there's a lot of focus on preventive and promotive programming. Unlike before, where there's a lot of focus on medical interventions. Then there's also a lot of increase and push towards public-private partnerships and cross-sector collaborations. This is really a good point for us because for CBID to function, we can't avoid networking, we can't avoid collaborations, and also we can't avoid partnerships. And one thing that's now irresistible is about innovation and technology. And this one thing that can really bring together the community and improve a lot of efficiencies, even in terms of data collection, data analysis and use, even in terms of communication, and even improving access to services in so many fronts. So I will end there so that I can provide time for questions and answer. And I'm happy that my colleagues here, Dominic and Mandisa, will also jump in to help. And maybe before I open up Daniel, if you allow me, I'll request maybe Dominic and Mandisa to make any comments or remarks. Thank you.
Thank you very much, David, and much obliged. David, Madisa, Dominic, Madisa, in whichever order you can come in.
Clearly, ladies first. Over to Mandisa.
Okay, thank you very much. Thank you, Daniel, for the opportunity, and David for the very detailed presentation. I don't really have anything much to add, except to thank you for spotlighting the CBID approach, and also just to maybe reiterate the intersectionality of our approach in working with communities, and also in addressing some of the most marginalized communities to ensure that they're able to participate and meaningfully participate in community living. David, perhaps if you can, maybe you can share some of the examples of at a later stage, once after Dominic, if you can maybe touch on how some of the projects have actually impacted on sustainability within different communities. That might be helpful. That would be great. Thanks.
Thank you, Madisa. Dominic.
Yeah, I won't add much. Thank you for giving me the mic, and I'll just echo the appreciation for David's great presentation. Maybe I'll just add 2 points. The first one is that in the context of community development, of course, there's always an engagement with the entire community, as David said. So in the CBID approach, we're really working with the entire communities. Now we're trying to make sure that inclusion happens, so that persons with disabilities and other groups that are typically left out in community programs are included. That's one point. And the second one is hinting at our global standards for community development that we have at IACD. So if you look at those standards, actually, they're very much 100% in sync with what David has presented, just to create that connection for our discussion. Thank you.
Okay, thank you, Dominic. And also, I also appreciate the point that you make towards the end. The whole aspect of focusing on the standards for community development, which I might also want to link with also what David was calling the irreducible minimums. When you talk about quality standards in delivering programs, and more so when you talk about a process where we want to be as inclusive as possible, we can do all the work that we do, but if we are not including the weakest segments of our population, and those who need to be part and parcel of community development most, and then of course we may not achieve much, because a chain is as strong as its weakest link, and we can be the strongest societies we can be, but if the rights and the needs and the concerns of those who are most disadvantaged, or who are in greatest need, or whose rights are not fulfilled, are not being addressed, then we may not be saying much at the end of the day. And the whole idea of looking at the issue of systems, where you look at the macro issues, and then looking at the person issue, the development, the community development at the person level, where now again we look at the micro issues, so that then ultimately community development makes sense to each and every individual. That will make our work be a lot more meaningful across the board, because then we are looking at things at the micro level and the macro level. It's just like saying I live in a country that is developed, and then when you open your eyes, turn back, then you find so many people who are in so much need. Then you start wondering, then where is this development we are talking about? And so we need to be able to contextualize all that we do, so that then we can be all have everybody on the table, and the issues that concern everybody at the table. Of course, the bias of CBM is with people living with disabilities, but of course, that is just one of the segments of population that needs to be part and parcel of community-based inclusive development, broadly defined. I want to open the floor for any interventions. David has just led us in the discussion, but we are all presenters. Because we come with all sorts of experiences from the work that we do on a day-to-day basis. And so the floor is open for any interventions.
Will I just go, Daniel?
Okay, please.
Just to open up. I thank you, David. I thought that was really good, clear presentation. And I think the overlaps, so Daniel's already highlighted them, the overlaps with the standards, the overlaps with the basic principles of community development in any neighborhood are very strong. What I was interested in is the kind of context, if you like. How do you get to the point of having it accepted by the different stakeholders or power brokers in a neighborhood? And I wondered if you wanted to say something about the kind of acceptance for the work. How does it come about? Is it something that there is buy-in within Kenya from local government, or is it something which is coming from the NGO that has to negotiate with local and central government to be deployed? Because without that kind of buy-in, it's very hard to get the kind of acceptance from all the stakeholders that is essential, and as you refer to it.
I can respond.
David, you can respond as we wait for more.
Yeah, okay, thank you. Thank you so much, Stuart. I really appreciate that question. And I think just reflecting even our own processes internally, any change is always painful because it unsettles the status quo and the comfort zone. So I remember when this conversation came up, the first, it was rejected by so many players in the CBR sector because there's a way of business that they were gotten used to. Already there was tools that they're also using. So it's like CBID by then, it was just a statement which is not well guided in terms of framing, in terms of even the buy-in and endorsement from the government. And so it has been a journey. But I can now confirm right now that after a lot of engagement and demonstrating that, yes, it works, looking at it holistically, now there's a lot of buy-in from the government. Right now, the Ministry of Labor and Social Protection has even a directorate department that is having a team working on CBID, but also bridging to CBR. And then also we have the Ministry of Health now developing some guidelines on CBID, just to make sure that it's now more implementable. Then apart from that, looking at the local level, equally our partners were very comfortable with CBR because some of them are rehabilitation centers, some were hospitals, and some were doing local work. But the flip side of it came from a point of how does it make a difference if you can bring the community on board as part of either members of the local board or committees, or as part of the you are champions at the community level who can actually advocate and even mobilize the community before even you come for your outreach programs. And how about if you can actually involve the local government in terms of just coming on the ground to experience what you do and how it translates into the community empowerment process. And I think that was a departure from thinking silo and being more of a wanting to conserve what you have and preserve everything, into thinking more objectively and opening up to various community conversations, engagement. So I'll say that right now, most of the programs that we have now have the caregivers and parents for children with disabilities at the community level. They also have membership into government health committees at the community level. They also have representation of the community into their own local boards where they also operate. And this has become like the norm because now it's very much easy in terms of getting other support on board and even forming what I can call locally as consortia or clusters, which brings together different players in different sectors to implement a shared program, but just through what I can call a coordinated mechanism, not pooling resources, but each one managing their own resources, but coordinating the implementation and sharing of lessons and programs. So it's a journey. Yeah, but it's always painful in the initial stages.
And David, can I maybe just add one aspect to Stuart's very important point? At the community level, it's the most important thing is to get across the message and create an awareness that including persons with disabilities and working on disability inclusion will benefit everyone in the community. I'll just give you two quick examples. One is if you reduce the barriers that exist in the community, for instance, to access a market, it will not only benefit a wheelchair user, but also an older person. It will benefit children. It will benefit people who find it difficult, have maybe a bit less energy than others to access the markets. And the other aspect I could give is we work a lot on early warning systems currently in disaster-prone communities, and inclusive early warning systems that are easy to understand. It's easy for you to grasp what do I need to do in the event of an emergency, benefit the entire population, not only a person with a hearing impairment or visual impairment. So just to give you these examples in addition to what David said.
Yeah, they're good examples.
Thank you, Dominique. Yeah, Stuart wanted to say something.
No, I think they're good examples, and I think I'm just trying to apply it more widely to how you actually, broaden this discussion out to a community development approach. And I think the points that are coming through strongly for me is the prior work that needs to go on within the locality with the different stakeholders. If you don't invest in that prior work and get that body of understanding, and a lot of what you said, I think, very much buying into the challenges you set out. But if you do that, and you get the prior work right, and that sometimes can be cultural work as well, I suspect. So people have to accept the principles of inclusivity, which is not always culturally there if you're talking about disabilities or other minority groups. And yeah, I have no more to add. Thank you. Yeah.
Okay, thank you, Stuart. And I think what comes to my mind at this point is there's so much energy that is locked in the people that we don't bring on the table or who are structurally left behind. And if we harnessed all that energy, we would even become a lot better, a lot stronger as communities. So we have Judith Malangu and Amidu Abdullahi. Let's hear Judith, and then we come to Amidu, who is my colleague in IACD board.
Good morning, colleagues. I'm Judith Mahlangu. I'm from South Africa. My background is based on community. I used to work as a community rehab worker before I work as a community development practitioner, and I specialize also in disability studies. I work for the University of Cape Town now. So I'm so excited and I'm pleased. The presentation has been amazing. Thank you so much, Prof, for the presentation. It's eye-opening. My take here is I just want to ask Prof in terms of the community rehab workers, the career construction of community rehab workers, because having been working on the ground, I've realized that we're losing valuable resources because they don't get support on the ground, because they are engaging more with persons with disabilities. And we find that in most cases, they are not supported, and also their career is not, they are not recognized, and also their career is not supported in a way that we support other disciplines. So what's the plan? Do you have a plan in terms of supporting caregivers, care workers, and community rehab workers that engage with persons with disabilities? Because these are the core people that are on the ground, that are doing the advocate, that are supporting, creating a space for persons with disabilities to empower themselves, also to advocate for them. Thank you.
Okay, thank you, Judith. And I think that's quite a critical question in terms of how do we take care of the caregivers so that then they can remain connected and engaged in doing what they need to do for the benefit of society, because their work still needs to be individually and personally meaningful. Hamidu.
Hello, am I audible enough?
Yeah, please, we can hear you, sir.
Yeah, good morning. Thank you for this wonderful session. And I also commend the presenter for this very explosive presentation. My area I want him to expatiate on is the issue of rehabilitativeness of disabled. How can it be done in the community, at the community level, and then how can it be done at maybe institutional level? For example, workplace, without tampering on their rights and justice. Thank you very much. And then well done, Professor Daniel, for a very good job. Thank you.
Muted. Thanks, Professor Hamidu, for the compliments and also for the question. Rehabilitativeness of the disabled, that's a serious concept, because
Yes.
we are trying to rehabilitate people, and I believe your question is, are they rehabilitatable? And of course, that has serious implications in terms of then how we operationalize our programming, so that again, we can have hope even as we design our interventions. But I don't want to respond to on behalf of David, because I think this is also the point at which, David, you can bring in the examples that Madisa was asking.
Thank you.
Thank you so much. Let me start with a question from Judith. I really appreciate your question, and I'll try to put it in the context of universal health coverage, because this is now the narrative. And I'll also share what CBM is doing and what the government is doing, and how we want to bridge the two. So in terms of our focus, I fully agree with you that the caregivers and the rehabilitative services workers at the community level equally have their own needs and equally face a lot of challenges. One ranging from even lack of source of income, even lack of the materials and the supplies, even lack of access to other opportunities in terms of support. Now, in our case, we have been working with partners to ensure that we strengthen the caregivers and the parents and the organizations of persons with disabilities, and including the caregivers in terms of rehabilitative services. In terms of mobilization, whereby they come together, they start some livelihood activities. Most of them choose village savings and loans associations, where they come meet on regular basis, they contribute, and they make a savings or even borrow among themselves. But again, some lack a source of income. So we have tried as much as we can to empower them in terms of alternative source of income. Some have chosen to do farming, either in terms of crops production, others livestock keeping, while some just agree to do some little business in terms of earning a livelihood. Then apart from that, we also try to push as much as we can for the enrollment in what we have as a national health insurance scheme, where the government has been targeting poor households who cannot afford the regular premiums. And some have been lucky, they have been taken, some have not been lucky, so they're still pushing on. Then the third one has been that the rehabilitative caregivers also become part of the community health promoters scheme. Because the government, through the developed government structures, has come up with what I can call a localized scheme of service for the community health promoters, formerly called community health volunteers. And some normally get a stipend, a regular government stipend. It's small, but at least it makes a whole difference. And also the government has come up with guidelines for the partners who engage them to give them at least a stipend upon engagement in different components. Then also we have trainings that we support them in different ways. We also have supported government to train them in using the government training curriculum in various ways. But above all, we are yet to hit what is required, because currently the government has been now giving out community health promoters kits, which has different sets of materials, equipment that they can use to manage certain conditions at the community level. And we are hoping that equally they can be absorbed into this kind of government plans so that they're not left out to run parallel to the government systems. But I still say that these are a drop in the ocean, because there are quite a number, and the government efforts are now starting off from the month of October. So we are still yet to really hit a large scale number that we can be proud of. Then in terms of the question from Mahamidu, in terms of rehabilitativeness at the community level, at the institutional level, for the community level, we have supported trainings of community resource persons in skills in the therapy areas, in terms of even supporting what I can call supportive, rehabilitative structures at the community level, whereby when you have no technical person, they can continuously support the clients before they can take them to the center. Then apart from that, also we have some who have been able to use their local materials to establish even therapy areas within the community. Some have identified space where they can actually have their, say, children with disabilities being taken care of as they engage in a shared community work. For example, they are doing a plantings for a given member or the weeding for a given member. They always have that kind of opportunity to actually pull together their resources into one home or one family. And then they do their work and then come back and get their children through the sessions and then go back. Apart from that, we also have linkages to the nearest dispensary, because this is how the government structure works here, that you link the community to the nearest health dispensary where they can get more specialized support from the health workers, so that the community aspect does not just run in isolation, but equally is anchored in what we have as community health units within the government of Kenya, which takes care of about 5,000 people in a given geography and supported by a given trained personnel in healthcare. But basically, there's still a challenge, especially when it comes to honoring of appointments in terms of clinics. There's still a challenge in terms of affording assistive devices. Quite a number are unable to afford even the devices. And also what I can call the issue of distance, traveling to the health facilities. So right now we're thinking of using 3D printing technology, which actually can use a mobile phone to take an image and then send to the fabrication unit to produce the prosthesis, and then send the person to train the person from the village, the community level, without really incurring a lot of cost for traveling. But still a challenge, I think for me, it's just like, it's when it's starting, because we have not really been doing this a lot. So equally, we're trying to say the same idea to the government to ensure that we enhance what they are calling the primary rehabilitative services by focusing at the lower levels of the community and the healthcare system. Then at the institutional level, adaptation has been like the reasonable accommodation has been like the way to go, whereby you are able to provide accessible and inclusive workplaces, ranging from the furniture to the technology, also to the support system in terms of human resource, and also ensuring that you are able to create a working culture that's very supportive in terms of either fighting stigma-related activities at the workplace, and just advancing the narrative of the employers, providing additional support for workers who have a disability. This is still a journey also, because there are no guidelines, and now we are trying to work with the National Council for persons with disabilities to see whether we can create some guidelines or framework on how respective workplaces can be more inclusive. We are a member of the Kenya Business Disability Network, which was established somewhere around 2021. And the private sector is a huge player when it comes to the workplace being more inclusive. So we are also trying to see how best we can model the interventions and influence even government on the same, but still work in progress in summary. Yeah. Mandisa and Dominic, feel free to jump in.
Thank you so much, David, and for the intervention. Of course, Mandisa and Dominic, you can always come in at any time, but let's hear what Professor Ogato has to say. Prof?
Yeah, thank you very much. Once again, I want to join others in appreciating David's very good presentation. From the presentation, as we all know, participation is key to the whole idea of inclusive development. From research and maybe some practice inside, we discovered that participation is a nebulous concept, one. And in terms of operationalization, it's not a very easy thing. Because if you have to take all segments of the society, of the community, you have to involve them, some sort of bottom-up approach to development. From this organization, from experience in terms of pursuing community-based inclusive development, I mentioned that the key issue there is participation. So my question is, are there practical insights that have helped?
Sorry, we have lost Ogato again. Dominic, you wanted to comment?
I think the question is clear. Let David go first, and then I can add.
Okay, thank you, Dominic. I'll just share an example. It was following the Horn of Africa food crisis in 2012, and CBM fundraised to support a program on the response that also led to recovery and resilience building. So we said this time around, we're not going to sit with a partner and a few people and develop the proposal. So I went down to Meru County, one of the areas that we implement programs, and told the partner to convene a meeting with focal people from the government, the community, and other stakeholders. And so the first question was that we have been successful to fundraise this amount of money. What do you want this money to do for you? And that's how the conversation began. So, and from the discussions, we realized that not everyone was on the table. So we said now, in the next meeting, bring so-and-so to present this group or this department or this sector. And the second meeting was now more productive because the people knew who should be on the table and what kind of role they were going to play in the whole conversation. The most interesting thing is that what we had in mind as areas of priority for intervention were not actually the ones that were selected, because people said, in these teams, we have people who can do 1, 2, 3. Some can keep fish, some can keep livestock, some can do crop farming, some will do tree nurseries. Some we want to do transports of farm produce to the markets. So we shall group ourselves into different groups based on what we can do. And that's how the budget was split. And then they identified what to do. And it was very successful. And I'm sure if you go back even right now, you'll get the impact of what the interventions did. So that's how actually you can create the voices to make a difference. Thank you. Over to Dominic.
Thank you. Thank you. I'll just add, I mean, the challenge is very clear, Professor. So what we see in many of our programs as a most important first step is that we actually begin the conversation long before a program is even designed and implemented, to first understand what the community wants to achieve. Like, you know, I believe in any good community development program, having a conversation with key stakeholders. We are typically doing what we call community mapping exercises. I think that was on one of your slides, David, also, where we engage the entire community to understand the issues, and oftentimes to make sure that persons with disabilities who are often excluded and marginalized from these processes, the very first step is to help persons with disabilities to organize themselves, get organized either in self-help groups, in small OPDs, or we help parents and caregivers get organized so that they can have an effective voice around the table when these conversations happen. So these are some of the strategies we apply across the board to respond to the challenge that you have named, which is of course a very real challenge.
Okay, thank you, Dominic.
Sorry, if I may, sorry, Daniel, if I may add actually to what Dominic and David has already said. But I think one of the things that we need to keep in mind, or that we try to encourage, is ensuring that we also, make sure that there is budgeting that is gender and disability responsive, right? To ensure the participation of persons with disabilities, for persons, women, who are sometimes also excluded in some of these mappings. Yeah.
Okay, thank you very much. And from what is coming through from Dominic, the whole aspect of engaging with the communities before even the stakes on the table is very important. And then, of course, from what Madisa is coming through, then, of course, facilitating what is come through the consultations in the community, so that then the issues that they raise are translated into actionable, deliverable outcomes, which then make sense to the community. That's very useful. And of course, Prof. Ogato, the whole question of participation remains quite a major area of concern. It's very easy to talk about it, and but then getting the mechanics of it, that's where most of the time we miss it, because of course time is of essence to many of the program workers, but for the communities, they are there and they will move when they are ready. But we have, our programs are timed, and that becomes at times a problem, how to push it so that then we can have that kind of common ground between what the community wants and what else they're involved in, and what we want to undertake in terms of our programming. And most of the time, of course, then what it becomes important is then to have a lot more open-minded perspective when you are getting the communities, so that then we don't go with our boxes that are already sealed, and yet we are talking about participation. We need to be a lot more accommodating, and that's the point at which then we need even to go and look out for those who even are likely to be voiceless, or are likely to be excluded, even when we say we are having a participatory process. But unless there is any further interaction, I've put on the chart the next steps in terms of this series. We have these meetings, this webinar, every second Wednesday of the month at 11 a.m. Nairobi time. Every second Wednesday of the month at 11 a.m. Nairobi time. And so the next edition on November is going to be a masterclass, where actually now we can get some more professional input and guidance on matters of participation and social inclusion. And John Conwell and Nancy Biwott, they are the experts in this. And when you come in, then be ready now to go into group sessions, breakout sessions, and get a lot more engaged in terms of then getting retooled in matters of participation. And then December is an open forum. We want to look at what is it that we've achieved over the year, and also to reflect what is it that maybe we've missed, and what is it that we need to carry forward. And then we can together plan for the coming year, so that then we continue engaged. This is a platform for the IACD members and our colleagues to connect and also to retool each other, so that we can have continuous professional engagement and development. Again, opening up the floor for volunteers to come out. You have a topic of interest, you feel you have some capacity somewhere, you need to give out, because the issue is when you learn, teach, and this is the opportunity for that to happen. Just get in touch, we schedule you, and we can all grow together and make the discipline great, and make community development practice great. And join me in appreciating David and the Dominique and Madisa have come to support him in making this such a wonderful and successful webinar, quite informative, quite participatory. Thank you very much, and have a good morning, a good day, a good evening, whatever your time. Sisi, thanks so much for supporting us all the way from New Zealand. We really appreciate your stepping in now that Jessica, our admin at IACD, had to take some time off. Thank you so much. Be blessed.